Our goal is to be able to basically translate what we do at the global level in terms of advocacy to the national level, to be able to provide something tangible for cities and for national governments. What we would like to do basically is work with different stakeholders, including cities, our key partners, ministries of health, our members, and different international partners to be able to help ensure that cities have comprehensive cancer control programs to be able to reach the largest amount of population. But one of the key components, which is really, really interesting, is that we really want to focus working with not only our partners the standard operating partners, all of the people that work in cancer control, but also with city governments, municipal governments. And this is what makes it so interesting, right? Although the City Cancer Challenge really is focused on public health, what we really want to make sure is that cities become involved and are feel empowered to take a stake in this. Because in the end of this, at the end of the project, what we hope is that this becomes sustainable and it becomes part of the regular operating procedure of cities. We also know that, when you focus on municipalities, right, even though it might have a population of 1 million or more, actually the extension, it goes out. So we'll actually have an effect on a larger population outside of the metropolitan area. Because a lot of times, what we're hoping is that essentially we'll have really good reference centers in each of those metropolitan areas. What really makes this project tick is our ability to be able to really engage the key players in each of those communities, in each of those countries that really need to be involved in this. And not just top down, but also bottom up. One of the things that for us is very important is that we don't just work with ministries of health or national cancer institutes, but we also work with cancer leagues, but also patient groups. A lot of times people tend to think that it only is the medical professional that really has anything to do with cancer control. But one of our key messages UICC has always had in terms of our advocacy is that you need to involve a larger group of people to be able to really ensure that you not only give the best care possible, but also are aware of what the specific needs of the patients are. And only patients can tell you that. Only caregivers can give you that, to give you that. So that's why we want to make sure that whatever we decide and whatever type of projects that we design at the city level are really multi-sectoral, that include all those different people, all those different groups. It's ambitious. This is a brand new experience for UICC. UICC has a lot of experience at the global level. We do a lot of work also at the national level, but to be able to provide this type of technical assistance, and it is very, very technical, is a whole new realm of work for us. And I think it's very exciting because global advocacy, really fighting to be able to make sure that there's more financing for governments at the national level is important. But what we really want to do is take those messages and convert them into something very tangible, right? So if we get it right, it will make a tremendous impact on the lives of cancer patients around the world.